Science under siege. Medical experts clash with Trump administration over health policies. In a startling departure from tradition, major medical organizations, typically apolitical, are increasingly at odds with the Trump administration. The core issue? Health policy decisions being made without the backing of robust scientific consensus. But here's where it gets controversial. These decisions aren't just raising eyebrows, they're sparking open rebellion from some of the most respected voices in medicine. And this is the part most people miss. It's not just about politics. It's about protecting the integrity of science itself. Over the past few months, the Department of Health and Human Services, HHS, led by Secretary Robert F. Kennedy Jr., has proposed sweeping changes to federal health guidelines. Among these are drastic shifts in vaccine recommendations and, most recently, an unsupported warning about a potential link between Tylenol and autism. These moves have prompted a rare public backlash from medical societies like the American Academy of Pediatrics, AAP, the American Academy of Family Physicians, AAFP, and the American College of Obstetricians and Gynecologists, ACOG. For instance, both the AAP and AAFP issued COVID-19 vaccine guidance that directly contradicted the Food and Drug Administration's FDA recent announcements. Notably, they no longer recommend the vaccine for pregnant women or children without underlying conditions. This divergence highlights a growing rift between established medical consensus and the administration's stance. Adding fuel to the fire, the AAP criticized the Centers for Disease Control and Prevention's (CDC) revamped Advisory Committee on Immunization Practices (ACIP), pointing out that some new members have a history of spreading vaccine misinformation. Last week, the ACIP voted to discontinue recommending the combined MMRV vaccine for children under 4, and shifted COVID-19 immunization guidance to an individual-based decision-making model. These changes drew sharp criticism from organizations like the American Medical Association, AMA. AMA board member Sandra Adamson-Freihofer expressed concern that these recommendations leave parents confused and limit their ability to make informed choices for their children. The AMA is concerned that this change not only reduces parental choice, but also reflects ACIP's reliance on selected data, she stated, calling on the administration to ensure ACIP operates as a trusted, evidence-based body. The controversy deepened when President Trump advised pregnant women to avoid Tylenol due to unproven concerns about autism. Multiple health groups, including ACOG, the Society for Maternal Fetal Medicine, and the Coalition of Autism Scientists, swiftly condemned this statement, emphasizing that no causal link between Tylenol and autism has been scientifically confirmed. Physicians worry that such warnings could cause unnecessary harm to pregnant women and their fetuses. AMA CEO John White highlighted the issue of evidence standards, noting, "If the administration talks about gold standard evidence, let's define what that means." The data presented at the press conference and subsequent media appearances fall short of this standard. In response, the HHS defended its actions, stating that Trump and Kennedy are committed to radical transparency and are following the science to protect public health. However, critics argue that the administration's approach lacks transparency and disregards established scientific processes. This tension was exemplified by the recent firing of former CDC Director Susan Monares, who refused to approve ACIP recommendations without seeing supporting scientific evidence. According to Monares, Kennedy dismissed her concerns, claiming there was no science behind childhood vaccine schedules. Experts like George Benjamin, Executive Director of the American Public Health Association, argue that previous administrations followed a logical, evidence-based process, even when decisions were politically or ideologically driven. The process we're seeing now is not transparent. It's not based on evidence, and it's being propped up by isolated scientists who seem out of step with the broader scientific community. Benjamin told The Hill. He added that while organizations like his aim to be helpful advisors, they need a trustworthy partner in the administration, something they currently lack. But here's the bigger question. Is the administration's approach a necessary shake-up of the status quo, or is it undermining public trust in science? What do you think? Are these policy changes justified, or do they pose a danger to public health? Let us know in the comments below. The debate is far from over, and your voice matters.